Leaking urine is so embarrassing, but you need to get help. There are simple treatments to get better, but you have to ask first. Watch this video to learn much more. I am Jeff McQueary, a Tennessee gynecologist. I'm here if your gynecologic problems are dominating your life and you want to take back control. Solve your problems with solutions from my channel, Women's Healthcare Answers. There are many different types of incontinence, but what we're going to talk about today is stress incontinence. What is stress incontinence? It is the voluntary leakage of urine due to pressure on the bladder. This is what we mean by stress, an increase in abdominal pressure that pushes down on the bladder. So later on in this video, I want to talk about how you can prevent these problems from potentially ever happening. So stay tuned till the end. So what causes pressure on the bladder? Well, things such as coughing, sneezing, laughing, bending, lifting, and even sex can put pressure on your bladder and cause leaking. Stress incontinence can become a big problem as you age, with up to 75% of women having some form of incontinence post-menopause into the geriatric years. But even 25% of younger women can leak urine. I've seen women in their early 20s that have severe stress incontinence, and that's why I wanted to talk to you about this today. Leaking urine is very embarrassing, especially when it happens in public. But also, it's even embarrassing when you're around your spouse. As a result, many women live with a diminished quality of life at home, at work, and they just don't talk about it. I often see women in my office that have suffered with these problems for 10 years or more and never sought any help. So the minimum evaluation that should be done for stress incontinence by your doctor is taking a good history of your problems, getting a urinalysis, doing a good physical examination, and maybe even seeing that leakage that you have with coughing. And if they at that point they can make a diagnosis of stress incontinence, that's great. The typical thing we see that goes along with this is urethral hypermobility. This is when the urethra becomes detached from the normal ligaments to the pubic bone. The urethra falls and opens up when you cough, leading to leakage. There are some forms of stress incontinence, though, which don't have this excess falling of the urethra, and those types of incontinence are more difficult to treat. But also, your doctor should check for how much urine you have in your bladder after voiding. This is called a post-void residual. It could give them information into whether or not they should do different treatments for you. But at the time of examination, if leaking of urine is not seen, then they may have you return to do a test called simple urodynamics. This is a process of backflowing saline, salt water, using a catheter into your bladder until you're full and seeing if you leak when you cough, bend, jump, or they may have you do all sorts of things that cause you to leak. Often insurance won't even pay for any treatment if you haven't had some sort of evaluation like this. So what are the treatments for stress incontinence? Well, number one is behavioral changes. These are simple non-surgical things that you can try first. Behavioral changes include not drinking too much fluid during the day, typically less than 68 ounces a day. Timing urination on a schedule, such as every 2 hours, so you don't get too full. Avoiding jumping or running. Avoid alcohol and caffeine because they definitely make you pee more often and put more urine volume out. But also losing weight. If you're overweight, it can have a significant impact on stress incontinence. But remember this, you can also leak while trying to work out and lose weight, so it can be a double-edged sword. But remember, even 8% weight loss has been shown to decrease stress incontinence episodes by up to 47%. So it might be worth going through the difficulty of losing weight to decrease your incontinence. So the second treatment is pelvic floor muscle training. These are Kegel's exercises, which strengthen your pelvic floor muscles that support the urinary sphincter muscles as well. These exercises can both improve stress incontinence and prevent the condition from worsening. In order to do these exercises regularly and with good technique, your doctor may send you to a pelvic floor physical therapist who specializes in these type of treatments. The third treatment is vaginal pessary. So a pessary is a ring-shaped silicone device inserted into the vagina. Pessaries push the urethra closed to help control urine leakage and allow you to urinate normally throughout the day. There's even a newer over-the-counter device called Poise Impressa. Its insertion is similar to a tampon, so they're very discreet, and it puts pressure on the urethra to maintain continence, and no one else has to know. So if you like this video so far, hit the like button. It really helps with YouTube. And please subscribe, because if you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up and please comment. So back to the information you want. The next line of treatment is urethral bulking. This is number 4. This procedure involves a substance injected into the urethra to bulk up the walls at the connection of the bladder and urethra. This is an outpatient procedure and can be performed in the office or in the operating room. The procedure has almost no pain and you can go back to normal activities right away. But it may need to be repeated after several months, but often that repeat is longer lasting and can give a really good result. Number 5, medications. Well, there aren't currently any medications that actually help with stress incontinence. But if you're found to have vaginal atrophy, such as in perimenopausal, postmenopausal time, this is thinning of the vaginal tissues, then vaginal estrogen therapy may really help to increase blood flow to the urethral muscles and thus increase incontinence. And number 6 is surgery. Surgery is only recommended after the cause of incontinence is well known. When you have tried conservative therapies prior to getting surgery, surgical treatment has a higher success rate than conservative therapy. The sling procedure is the first thing. This is the most common procedure for women with stress incontinence, and it's considered to be the standard of care. So a permanent mesh sling is placed to support the urethra, and it's all done vaginally and outpatient. I know mesh got a bad name, but that was larger pieces of mesh placed around the bladder and rectum, which is no longer recommended. This is a thin strip of mesh placed under the urethra. It's very effective. It's been done since 1998, and I have personally done over 4,000 of these procedures with 90% success rate. So the next thing is what's called an autologous fascial sling. This is a sling made of your own strong tissues, and they're placed under the urethra to support it, just like the mesh sling does. This is more commonly done when you don't have a lot of that urethral mobility that we talked about earlier, you prefer no mesh, or you've had previous issues with a mesh sling. And less common now is a retropubic colposuspension. This used to be called a Birch procedure. Sutures are attached to ligaments at the pubic bone to lift and support the vaginal tissues near the bladder and upper urethra. It is a much more difficult procedure, so that's why it's less commonly done now, but it does not involve mesh, so some people may opt for this option as well. So to avoid all these procedures by not having stress incontinence in the first place, prevention is the key. How can you prevent stress incontinence problems from ever happening? Well, go to the bathroom when you need to go. Often people hold their urine in because it's not a convenient time to go to the bathroom. However, regularly holding your urine in can wear out your bladder muscles. You also want to lose excess weight by eating healthy. This may prevent factors that raise your chance of developing incontinence, such as morbid obesity and diabetes. Also, drink enough liquids, but not to excess. Try to drink no more than 68 ounces of water a day. Treat that chronic cough. Will lessen your risk of stress incontinence and improve your symptoms. I've seen a lot more incontinence after COVID, and we see this during cold and flu season with an increased risk for leaking urine. But also quitting smoking at any age is good for your bladder health and overall health. Smoking raises your chance of developing stress incontinence by that chronic coughing. So also avoid constipation and straining, which can make your urinary tract health worse and can lead to incontinence as well. To prevent constipation, eat plenty of high-fiber foods. But also, you can do pelvic floor muscle exercises at home and bladder training. These are daily Kegels exercises, and they can make those muscles stronger and help keep urine from leaking out when you laugh, cough, sneeze, or lift. There are good examples all over the internet about Kegels exercises. The next thing would be to treat vaginal atrophy with vaginal estrogen therapy. And lastly, vaginal delivery. We see a lot of damage from childbirth. The majority of injuries to the pelvic floor occur even after the very first vaginal delivery, and this is where we see incontinence issues. Prevention strategies for vaginal deliveries must focus on less use of episiotomy, pre-delivery perineal massage, less use of forceps-assisted vaginal delivery, and if needed, vacuum causes less damage than forceps. Elective cesarean section is the only true prevention strategy for childbirth injuries to the pelvic floor. So I'm not necessarily saying that you need a C-section, but it may be the only way to prevent these injuries from leading to incontinence and other pelvic problems. So I think that these are really definitely discussions you should have with your obstetrician and decide what is best for you. So hopefully you feel you learned something. And as always, I've enjoyed being here with you. I would love to help solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I give you.